Before we begin, the patients, caregivers, and community-based organizations of the Sickle Cell Consortium are delighted to provide Warrior University as an online curriculum-based education model. However, please note, this is a general discussion and is not meant to replace the advice or instructions of your doctor or other healthcare professional. Statements made are not meant to reflect the policies, thoughts, or opinions of the consortium and do not imply endorsement or recruitment for any product, service, or clinical trial. As a reminder, this class is recorded and will be made publicly available online. Private questions should be addressed to me, listed as the Sickle Cell Consortium, or directly to the presenter. And I will now like to turn it over to Dr. Lakia Bailey, who will do our introduction of our presenter.
Thank you, Dominique. Hi, everyone. Thank you all so much for joining us. Please, as you log in, go ahead and mute your phone, smartphone, or to cut down. Please go ahead and mute your your phone, smartphone, or tablet to cut down on background noise. It is my absolute pleasure and honor to introduce Dr. Andemariam, who has joined us to talk to us about COVID-19 and sickle cell disease. I am Dr. Lakia Bailey. I am the founder and executive director of the Sickle Cell Consortium, and we are a network of patients and caregivers just like you all. Our goal is to come together as a unit to identify problems, needs, and gaps in the sickle cell community, and then to address those needs and gaps. One of the things that we're super excited is to be able to bring Dr. Andemariam. Dr. Andemariam is a hematologist and the founding director of the New England Sickle Cell Institute at the University of Connecticut Health Center. Her research focuses on developing new pathways of care that improve sickle cell disease care quality, as well as translational research on deciphering the interplay between red blood cell adhesion to the walls of the circulatory system and the development of pain. Dr. Andemariam holds an undergraduate degree in molecular biology from Princeton University and a medical degree from Tufts. She is also the Chief Medical Officer for the Sickle Cell Disease Association of America. We're very, very, very excited about the leadership and the work that SCDAA is doing as we face this new challenge. COVID-19 is a new challenge that we have never faced before as a community. I am, however, absolutely convinced that as a community, we have the ability to come together and to really change things and to ensure that our community has their resources and the needs met and remains educated to keep ourselves healthy. SCDAA, Dr. Andemariam will most likely talk about it. I've sent out emails. You all have documents of the living document from SCDAA. This presentation is coming from there. I encourage everyone to go onto the website and to become familiar with that document and its changes as it is changed weekly. Dr. Andemariam, we're very, very grateful that you're willing to come on and talk to us, talk to our network of patients and caregivers, and help us to learn the things that we need to do to stay safe, as well as to provide the leadership that we are doing as a community to ensure that our needs are met. Thank you so much, Dr. Andemariam.
Thank you, Dr. Bailey. Thank you very much. I'm appreciative to the consortium for inviting me to address the community at large today about COVID-19. A lot of people call it coronavirus. The correct term is COVID-19. And I'd like to talk to you about how it is potentially currently impacting and potentially in the future impacting sickle cell disease, those who live with it and those who advocate for it and those who care for individuals living with it every day. So thank you for the introduction. I will definitely take questions at the end of the presentation. So bear with me. So what is COVID-19? So COVID-19 is actually a brand new virus that was first isolated and identified at the end of 2019 in China. And as many of you know, I'm sure at this point, it's since that time has spread globally and very quickly in recent weeks. And the projections at this time tell us that it really hasn't peaked in terms of the number of individuals across the globe that will be infected. There are a lot of implications associated with being a new virus. And if you can think a little bit about your body's immune system as being, if you can try to think about your body's immune system. Sorry, can somebody mute?
They wouldn't waste their energy and time to come and do something like this.
So if you think about your body and its immune system being like the Army, the Navy, the Marines, and all of those uniformed services and military personnel working together to fight a battle, the immune system does the same thing. It has all of these cells that come together to fight disease and fight infection. And they're best at doing that when they've seen that infection before. When the human body is challenged with an organism like a virus that it's never seen before, the ability to fight it is very weak. So that's why you're predominantly seeing individuals across the globe being infected and being so sick from the disease, because no one on Earth has seen it before, and no one walks around with what we call immunity. So what's some of the knowledge that we have about COVID-19 and sickle cell disease? I'm going to go over that with you in subsequent slides, but I want to impress upon you early in the talk that what we know about COVID-19 and what we know about its implication in those who live with sickle cell disease is really an evolving landscape. And what I tell you today may change tomorrow, may change next week, may change next month. But I wanted to at least introduce COVID-19 as a discussion point and tell you what we know about it today. I've been very fortunate to work with almost 30 experts, predominantly hematologists, researchers, and psychologists, and nurses from across the globe on the Medical and Research Advisory Committee at the SCDAA. And so we've put forth some recommendations in these slides for you. But you need to know that the risk to our community, our sickle cell community in particular, is very high, and that it is paramount that you stay informed and updated regularly. If you look at the world map here on the right side of this slide, I don't know if you can see my pointer, you'll see that across the world right now, as of 4 o'clock this afternoon, I got this from the CDC website, that there were 372,000 cases diagnosed across the world. And if you look at the breakdown of countries, you'll see that as of today, the United States is in third place behind Italy and China. But we are rapidly rising in terms of confirmed case count. And it's projected that we will probably surpass Italy sooner rather than later. And we're all concerned that we may even surpass China, which would be very concerning. If you look over here, out of 42,000 cases of COVID-19 that have been diagnosed amongst individuals living in the United States, 187 have recovered and 500 have died. This is very different compared to what you see here in Italy, and many of you might know that Italy has been hit very hard by COVID-19. You'll see that out of 63,000 confirmed cases, they've had 6,000 deaths. So if you do the math, their death rate is much higher. And I think we're unclear at this time why their death rate is so much higher than what we're seeing in the United States. And this is the type of information that I think will be evolving day after day. And hopefully the fact that this virus started in another part of the world will be hopefully an advantage to those of us in the United States who are really just gearing up now to combat it. I'm hopeful that we will have learned lessons from our brothers and sisters in China and Italy and other parts around the globe who've been affected for a longer period of time. So one thing I want everybody to know about COVID-19 is that it actually is a real problem. It's a pandemic, which really is defined as an infection that covers the globe, that affects everyone around the globe. It's a simple way to understand it. And that what you're seeing in the various social media and news media outlets is not an exaggeration. This is real, and it's not what a lot of people may think is fake news. The pandemic is a real problem. All of us, whether we have sickle cell disease, whether we have some other chronic medical condition, whether we're perfectly healthy, we're all at risk of getting infected. And individuals with sickle cell disease, as many of you know, live with a weaker immune system than other people. And so individuals living with sickle cell disease are by definition more at risk of having a serious infection associated with COVID-19 and having a really bad outcome associated with being infected with COVID-19. And we're all super concerned about that. You know, I think it's common sense to say that really the best way to prevent any serious illness or complication from being infected with COVID-19 is to try not to get infected with it in the first place. So you're going to see in the tips that I give you in the following slides, the number one course of action to stay healthy in this pandemic is to try not to get infected. So what can you do to prevent the spread of COVID-19? First and foremost, and you're probably hearing this in your various communities and from your various political leadership, stay home. If you can stay home, stay home. If you still live in a part of the United States or the part of the world in which staying home is not yet mandated by your government, consider doing it anyway. Consider doing it anyway. Staying home and staying away from other people who could pass the infection to you is your number one defense against getting COVID-19 and having a really bad illness and outcome. So don't leave your house unless it's absolutely necessary. If you do leave your home, or even if you're in your home and you're touching various surfaces, make sure you wash your hands over and over and over again several times a day. This is best done with regular soap and water. And the CDC recommends washing your hands continuously for 20 seconds. And, you know, you'd be surprised how short an amount of time most of us spend washing our hands. So if you could sing the alphabet song while washing your hands, I guarantee you, you'll be surprised. It's exactly 20 seconds. If you don't have access to soap and water, consider using hand sanitizer that has at least 60% alcohol. Avoid at all costs touching your eyes, mouth, nose, and face, because that's an easy way to transmit the virus, which you can pick up by touching a surface and then touching your face, and then the virus gains entry into one of those openings in your face, your nose, your mouth, or your eyes. If you start to feel sick, and we'll go over some of the symptoms later, the most important thing is to call your medical provider immediately to get advice. In order to try not to get infected with COVID-19, in addition to staying home, you know, if you can't always stay home and you have to go out for various reasons, avoid being close to people who are visibly sick. So people who are coughing or might, you know, look like they have a fever, runny nose, sneezing. Stay away from those individuals. But also, please recognize that people can be carrying the infection but not yet have symptoms. The amount of time that somebody can carry the virus and not have symptoms can be very long. It can be up to 14 days. So it's really important that you stay away from people, not only when they're looking sick, but even if they're looking well. And I think you'll probably see on most of the news outlets now that the recommendation is to stay at least 6 feet away from everybody, something that's being termed social distancing. So greet one another from a distance. Don't give any handshakes to anyone, no high fives, no hugs. Just, you know, a nod is fine, a smile. Keep away from people as much as you can. If you've got surfaces around your home, particularly handles, door handles, doorknobs, disinfect them frequently because, again, those objects that people touch who might be carrying the virus on their hands can be transmitted to you. So clean and disinfect those surfaces regularly. If you yourself cough or sneeze, use a tissue that you can throw away right away. Or if you need to cough, you can always, if you don't have a tissue, you can always cough into the inside of your elbow and turn away from anybody that's around you. Because if you're carrying the virus, you don't want to spread it to other people in your family or in your community. So how do you know if you have COVID-19? So the only way to know for sure is to actually get tested, and it's not a blood test. It's a test where they swab the inside of your nose. If you've ever had a test like for influenza or the common flu, you might have had that done. It's not very comfortable, but it doesn't last very long. And so it doesn't require blood. It just requires a healthcare worker to put what looks like a long Q-tip into your nose, and they can get some of the fluid there and send it off to the lab for testing. That's the way that you get tested. As many of you know, in our country, we've had challenges in many communities, many states, in having an adequate number of testing kits available to test everyone who thinks they may be infected. But that seems to be improving, at least in some communities, day by day. And I will tell you, in my own state of Connecticut, we went from being able to test just a handful of patients a day to hundreds of patients per day in just a matter of a week. So I think that a lot of states around the country are going to see an easier time being able to actually test individuals. So how do you know if you might have COVID-19? So the three main symptoms to look for are fever, a cough, and shortness of breath. Another way to describe shortness of breath is feeling like you're just short of breath, like you just can't catch your breath. You feel, even with hardly moving around, you feel really tired and you can't take a full deep breath, like as if you ran up the stairs really quickly. If you're experiencing shortness of breath, cough, or fever, those are the key signs of COVID-19 infection. What I will tell you is that there are some emerging data that suggests that sometimes GI symptoms like diarrhea or nausea or vomiting can also be an early signal in some populations of patients. And in some patients, profound fatigue can also be a symptom of COVID-19. So this would be fatigue, shortness of breath, over and above what you might already have from your underlying sickle cell disease. If you have any of these symptoms, it's important that you call your doctor right away to discuss what you should do next. And every healthcare institution approaches this a little bit different. And that's why my best recommendation for you is to call your doctor or your nurse practitioner, whoever it is that cares for you, and get advice on the next best steps and whether or not they think you need to get tested or be seen in person. So if you have a lot of trouble breathing, or you have significant, really like continuous persistent pain or pressure in your chest, or you're confused, or someone tells you you're acting confused, or they can't wake you up easily, or someone tells you that your lips or face is starting to look blue or dark, those are serious signs of not getting enough oxygen. And so it's imperative that you call 911, or that your family members or caregivers, if they're watching this, know to call 911 on your behalf. So how can you, someone living with sickle cell disease, or someone caring for somebody or loving somebody with sickle cell disease, get prepared in the midst of this pandemic? Well, think about the things that you need to have in your home to take care of yourself on a daily basis. Start there. Most of us take for granted that, if we needed something, for the most part, we could, within, a few hours or a few days, go get it from the store or the pharmacy. Or But we're living in a situation right now where staying home is the safest option. So in order to be able to do that effectively, you have to be well stocked. So first and foremost, look at all of your medications and make sure that you have enough. And if you're a caregiver or a parent, look at your child or your loved one's medications and see whether or not you need refills. We're recommending at this point that you have weeks to months of prescription refills at home to get you through what at this point is really an undefined period of time. We don't know how long we're going to have to be effectively sequestering ourselves in order to protect ourselves from getting this virus. So look in your medicine cabinets, your drawers, and check out every medication that you're on and make sure that you have enough. And if you don't, call your doctor's office to get extra medication. So you don't need to do this tonight. You don't need to call the on-call person, but tomorrow morning, sometime during the day, call your doctor's office and go over the medications that you have. Be prepared to tell them, how many pills you have and how many refills you have left, and be prepared with what pharmacy you want them to use. And I'm hopeful that they will be able to call these medications in for you without a visit in every case. Sometimes they might say you have to come in, but they might possibly say under these circumstances, we'll call some medications in for you. Don't forget the over-the-counter medications that sometimes aren't able to be given by prescription. And those include things like Tylenol, also known as acetaminophen, which is good for fever, and other supplies for if you have a really bad cold, like tissues, cough suppressants. Just think ahead and make sure you have those items on hand. It's also really important to have a thermometer because, as I told you, one of the signs of being infected with COVID-19 is having a fever. So you want to have a thermometer on hand because when you talk to your medical provider, they're going to ask you what exactly your temperature was. That's going to help them gauge what to do with you next. So it's not really enough to say you think you have a fever. You have to take your temperature, write it down, and let them know what it was. Also, preparedness is keeping yourself as healthy as possible. So you should take all the medications that you're prescribed, as prescribed, every day. And these include hydroxyurea, L-glutamine, penicillin if you're a child, folic acid, voxelotor, crizanlizumab, iron-lowering medications such as deferasirox, some of you know it as Jadenu, and any other medication that you're on, whether it's for blood pressure, diabetes, anxiety, depression. Take all your medications as prescribed. Now more than ever, it's really important. You want to stay as healthy as possible. So if you do get infected with COVID-19, your body is as healthy as possible. And also to prevent some of the complications for which you're on these medications, you should be on them regularly anyway. So how else can you get yourself and your loved ones and your family prepared? So think beyond medications, think beyond that. So what household items and food do you need to have on hand so that you're prepared at this point to stay home for a long and undefined period of time, which could be weeks and maybe months. Figure out ways to get these items without leaving your home. There are some home delivery services that will deliver items that you order online. Or if there's someone in the community who's healthier, younger, willing to do shopping for you, ask them to do that for you. And stay in touch with other people by phone, email, text, social media. What we're all about to undergo could be a very isolating experience. And I think it's important to keep in mind the mental and emotional well-being of ourselves as we're going through this. So keep in touch with people. And if you become ill, it'll be that much easier to reach out to somebody for help. So think ahead. If you do get sick and you need to go to the hospital or you're in bed for a long period of time recovering, think ahead about who's going to watch your children or other loved ones that you may care for or pets that you have. Think about it, write it down, be prepared. And if you're working and you're still going to work in person, find out if working from home is an option. So what do you do if you have a fever? Now, many of you probably know that a lot of times individuals with sickle cell disease have fever for other reasons or for other infections. So first of all, don't freak out and don't just assume that you have COVID-19. Don't think the worst because more likely than not, your fever is being caused by something else, but it needs to be addressed. Don't immediately go to the emergency department. And the reason I say this is because the emergency departments are full at this point with a lot of people who probably do have COVID-19. So it's not worth it unless absolutely necessary to go to the emergency department to figure out whether or not you have it when you can call your doctor right away. If you have a doctor, that's the best thing you should do. So again, use your thermometer before you call your healthcare provider to find out what your temperature actually is, because they will ask you. And understand that, you know, lots of different infections can cause a fever. And again, this is not automatically meaning that you have COVID-19. When you talk to your doctor, ask about where they want you to go. They're going to ask you about other symptoms, so be ready to address that. For example, if you're calling the doctor on behalf of a loved one with sickle cell disease and a fever, make sure they're close by next to the phone, because the doctor is going to ask you for other symptoms to help them figure out the next best steps for how to help you. So another question some of you might be thinking to ask is, should you continue getting your chronic transfusions? And I think one of the important messages to get across is that you really should continue all of your treatments until you talk it over with your doctor or your healthcare provider. This is not the time to stop taking treatments. And there's no evidence right now that COVID-19 is in the blood supply. There's no evidence of that. So it's assumed at this point that blood is safe. But you have to balance whatever your need is to be on transfusions to reduce stroke or maybe acute chest syndrome or whatever, for whatever reason you're on transfusions. You have to balance that need for the risk of getting COVID-19 when you go in for that transfusion, because clearly you have to leave your home and go into a healthcare setting. So you need to talk about that with your doctor if you have any concerns about going in for a transfusion. Talk to them first, because there may be some serious consequences to you if you missed your transfusion, and everybody's different, so you need to have that discussion with your doctor. If there is a shortage of blood supply in your area, and I'm assuming at this point that nearly every corner of our country is experiencing a shortage of blood supply, ask your provider if there's an alternative for you. Of course, I think most of the recommendations you're going to see, including those coming from the SCDAA Medical and Research Advisory Committee, are to continue transfusions wherever possible. But do know that with further and further shortages of blood supply, being able to keep up with the needs with everyone, including those living with sickle cell disease, is going to get harder and harder. So again, should you continue getting your chronic transfusions? It's an individual decision between you and your doctor. So please give them a call if you have any questions. Another question. So should you go to the emergency department if you're feeling ill? I hope you've understood at this point in the talk that you should really try not to go to an emergency department unless you have exhausted all other options, or unless you have those symptoms on an earlier slide where I said you need to call 911, like if you look like you're not getting enough oxygen. So emergency departments, as I said, are really full and busting at the seams right now. There are long waits, and there are definitely people there who are likely to be infected with COVID-19. That's why they're there. So your risk of catching COVID-19 in an emergency department is really high. So you know your body best, you know your loved one's body best. Think about whether or not going to the emergency department is your best or only option. And if you have other options that are safe options, use those options first. So how about this? I actually hear this question sometimes. I have sickle cell disease, excuse me, I don't have sickle cell disease, but I still want to help. What can I do? I can't say it enough. Go donate blood, go donate blood, go donate blood. And as you're going to donate blood, pick up somebody you know who you can take with you to donate blood. We are undoubtedly going to have a severe blood shortage, and it's going to make it really difficult for all the people in our country who need blood transfusions, including those with sickle cell disease. Because of the pandemic, a lot of routine blood donor drives have closed down. But I will tell you that blood donation organizations like the Red Cross have instituted safety measures to actually practice appropriate social distancing in their blood donation centers. So they're keeping donors further apart from each other to try to adhere to the CDC guidelines of social distancing. So if you yourself or someone you know is a healthy and younger person, someone who's less at risk for severe complications from COVID-19 infection, please donate. And spread the word far and wide through all your networking methods. Get the word out. If you want more information, at the bottom left here, you'll see the website for the Red Cross and also sicklecelldisease.org, which is the Sickle Cell Disease Association of America. There are 46 member organizations across our country, almost one in every state. So you can go to that website and contact your local or closest member organization for more information. A lot of the SCDAA member organizations are mobilizing blood donation efforts in your local communities. Oops. So lastly, how do you stay informed? How do you stay updated? Because as I said, some of this information may change, may evolve. Again, you can go to the SCDAA website, sicklecelldisease.org. You can go to an online platform with curated or information that's been vetted by professionals and members of the advocacy community. It's called onescdvoice.com. There'll be posted guidelines and recommendations there. There are blogs, there are chat rooms. So you can learn from your peers, you can learn from experts. So that's a trusted resource as well. And of course, the CDC has a dedicated site, cdc.gov/COVID-19, which is constantly updated. And the first two sites will also have regular updates from our SCDAA Medical and Research Advisory Committee, which I chair. And we are updating both patient and caregiver as well as provider recommendations on a weekly basis as new information emerges. Thank you. I will take any questions you might have.
Thank you so much, Dr. Andemariam. So we are going to be, please, if you have questions, please type it in the chat. If you are on Facebook Live, please type it in the chat and we will get to your questions. So we are going to begin with the first question that we have. Someone asked, what is considered a high fever?
A high fever, well, a fever in sickle cell disease is generally defined as 101 degrees Fahrenheit or higher. So that's 101, not 100.1, 101 or higher.
Okay.
Question.
Next question. Those symptoms sound the same as acute chest. How do we know the difference?
That is a fantastic question. So You are absolutely right. The symptoms of COVID-19 infection do very much mimic those of the acute chest syndrome, which is exactly why it's important to get medical advice if you feel fever, shortness of breath, or have a cough. Remember that a lot of times people who have the acute chest syndrome also have chest pain, but not always. So just because you don't have chest pain doesn't mean that everything's okay. So I will tell you that our committee that's convening regularly and develop the provider guidelines to go along with the patient/caregiver guidelines, we have addressed that question and are providing guidance to the medical community on how to look specifically for the acute chest syndrome in individuals with sickle cell disease who are calling for fever or shortness of breath or any signs and symptoms consistent with COVID-19 infection. And those provider guidelines are available on the SCDAA website as well for you to take a look at. And I think you'll hopefully appreciate that the provider guidelines really do complement exactly what we're giving as recommendations to patients and caregivers. So we're not telling patients and caregivers to do something differently than we're advising the providers to do. And hopefully those two suggested recommendations will coalesce nicely.
Thank you. Since this is a respiratory virus, how should those who smoke marijuana adjust their behaviors to protect their lungs?
So they should, okay, this is my own personal opinion, they should stop. So anything that's inhaled is a bad idea. You have to protect your lungs. Anything that's inhaled can be an irritant to the airways of the lungs. If there are other ways to utilize cannabis, that doesn't require you to inhale it, that would probably be a better option.
Okay. Another question is, what does acute chest feels like?
So acute chest, so I've diagnosed a lot of my patients over the years with acute chest syndrome. And what I'll tell you, most people say is they're having chest pain that feels different from a usual sickle cell pain crisis episode. It feels different somehow. And they oftentimes have a cough. They don't always know that their oxygen is low until they come in for evaluation and we check it and we see that a lot of times it's low, but people don't necessarily feel that. But it's usually the chest pain and the cough and sometimes fever.
Thank you. We have one from a parent. She says, my daughter has sickle cell trait, so I'm concerned about the possibility of this increasing the likelihood of severe symptoms. I know medical professionals will often say that sickle cell trait is entirely benign, except in those cases when it causes sudden death. So it's just a bit confusing. I understand the circumstances of hypothermia, dehydration, at high altitudes that can result in death of those with sickle cell trait. But this is indicative of there being some underlying issue connected to the hemoglobin. And given that COVID-19 often results in pneumonia, and pneumonia is the leading cause of death of those with sickle cell disease, I just wanted some guidance on whether those with sickle cell trait should be concerned about being in the at-risk category.
That's a really thought-provoking question. I appreciate whoever submitted that. So as far as we know, and like I said in the beginning, there's a lot we don't know, but as far as we know, there's not a reason to believe it now that sickle cell trait confers any increased risk of serious infection with COVID-19. But I will tell you, I think buried in your message and your question is that there's a lot that we don't know about sickle cell trait. So if I were to, give you sort of a off the record, unofficial recommendation, I would say that you or whoever has sickle cell trait should really practice what everybody across our globe should be practicing right now, which is social distancing and doing everything you can not to get the infection in the first place. But I'm actually going to take your question to our Medical and Research Advisory Committee, because I think it'll be thought-provoking for those individuals as well. And perhaps we need to specifically look at sickle cell trait amongst those that are infected. It's a very good question.
Well, this parent has a two-part question for you, and I believe this one's going to make you think also, Dr. Andemariam.
Okay.
There are also those who believe the fact that anti-malaria drugs are supposedly a treatment for this virus. This is connected to sickle cell trait as well, since there is some malaria for those with sickle cell trait. Can you please offer some perspective on this? There are several opinions being offered, and I believe they're likely not particularly informed on the subject.
There's several. Did you say opinions being offered?
Opinions.
Opinions. Okay.
Opinions.
Okay. Well, I haven't heard any of the opinions to this question. This is a really good question. I can see why there might be. I can see why one might think there's a link. And I'm trying to see if there is a link. You're right. So it's really believed and probably true that sickle cell disease evolved in the first place in humankind because carrying the trait was protective against severe infection from malaria. So I mean, it is really thought that it was an evolutionary advantage to have sickle cell trait because so many children in parts of the world where malaria is endemic die before the age of 5 just from malaria infection alone. So you can imagine kids who live in those parts of the world who have sickle cell trait are less likely to die from malaria and live into adulthood. And once they're adults, they have children of their own, and they're able to pass the sickle cell trait onto more and more generations. So I'm not convinced that the fact that a drug that's being examined now, which happens to be an anti-malarial drug, has anything to do with that connection. Really reaching to see how that could be biologically. But I'm glad you asked the question because I don't think that there's an exact link. But again, this is definitely making me think really hard. And maybe we should do this Q&A again, so I have more time to think about that.
Yes. We have another question.
Dominique, I'd like to, Dominique and Dr. Andemariam, this is Dr. Lakia Bailey. I'd actually like to comment on that question because I've seen it a lot. And I think that people are hearing malaria and thinking about that link between sickle cell and sickle cell trait and malaria. But we're not really thinking about the fact that they're specifically talking about anti-malarial drugs. Right. And so anti-malarial drugs are a little bit different than malaria itself. Most anti-malarial drugs, they target when the parasite attacks the red blood cell. And so when you have sickle cell, you're sort of protected against it because that mutated kind of cell makes it difficult for that parasite to attack it. Most of these drugs, they target that phase, which is the phase where infection occurs. And so the way that these drugs work, it's not directly connected to the same reason why sickle cell trait is protective against malaria. And so if I had to guess, thinking about the logic of it, I wouldn't think there'd be a link because the drug works a bit differently. It's not the same way in which the trait is protective. Mm-hmm. I'm not sure if I'm making sense, but I thought about that one.
You're making sense, and I can see why people are developing the link, but to my knowledge, and it sounds like to your knowledge, no. Yeah, I like your explanation.
Okay, thank you. Another question, we're still on sickle cell for trait warriors. Do you have any specific advice for trait warriors?
Specific advice for trait warriors. You can donate blood.
Excellent advice. Are you aware of anyone in the sickle cell community who has been diagnosed with COVID-19?
Yes. Yes. I have reports of several, probably just a handful of individuals with sickle cell disease and COVID-19 in various countries around the world. And to my knowledge, they have all done well. Nobody has died. There is a registry that's being developed in the United States, but it's going to be a global registry where physicians, mostly those who take care of individuals living with sickle cell disease, are going to be inserting information about anybody with sickle cell disease that they care for that tests positive for COVID-19. This will be a private registry where people's names and protected information will not be a part of it. But it will enable the medical professionals across the globe to begin to see what it was about certain individuals with sickle cell disease who got sicker than others or who did better than others. Is there actually more acute chest occurring in the setting of having COVID-19 if you have sickle cell disease? You know, some of the things we think could happen, we're not sure, and we want to find out. We also want to learn from each other. For those who've taken care of individuals with sickle cell disease, COVID-19, what they did to help them get better, what worked. Was it you know, antibiotics? Was it using one of these anti-malarial drugs? Was it some clinical trial drug? What was it that they did that helped that individual get better, so we can all learn from each other?
Thank you. We have another question. I am in a home with someone who still has to leave for work. She is very paranoid and stressed as she does not want to expose her niece, who has sickle cell disease, to any virus. Would it be a good idea for her to take steps to work from home?
Yes. Anyone who can work from home, particularly if they live with somebody who's at higher risk for COVID-19 infection or a serious complication from it, like someone with sickle cell disease. If you can work from home, that would be better. There are some people that simply can't work from home. Their jobs just don't permit it. I mean, I'm one of them. I have, you know, nurses, doctors, you name it, the postman. There are so many people out there. So if you're one of those individuals, you could try, you know, you could try to keep your distance within the home as much as possible. There are, you know, there are people that I know in the health profession, like nurses and doctors, for example, who have small children, who have elderly parents, who have a loved one that they live with who's getting chemotherapy and doesn't have a strong immune system and is at really high risk. They are not necessarily moving out of the home, but they're possible they're staying in a different bedroom. They're extra cautious about wiping down all of the surfaces in the home on a regular basis to disinfect the handles and the common surfaces. So there are ways to still maintain a normal living situation, but just practice a bit of distance. I think you'll see that a lot of families across the world are doing this right now.
Yes. Another question is, how can you tell COVID-19 pain from SCD pain?
Well, as far as we know, COVID-19 infection doesn't cause pain. I've not read of any reports where people who've been diagnosed with it that don't have sickle cell disease have any reports of pain. So if you're having what feels like a pain episode or a pain crisis, that's probably what it is. But if you're exhibiting, you know, some of those other signs of COVID-19 infection, like fever, trouble breathing, or a cough, then you shouldn't just assume that what you're experiencing is a pain episode and nothing else. But just the infection alone is not considered to be painful. I think maybe what I'm hearing in this question, there are reports that in some subpopulations of patients with COVID-19 infection, they have some chest pain, but I've not heard that to be a common symptom, and it certainly wouldn't be the kind of sort of diffuse all over different parts of the body pain that people with sickle cell disease in a pain episode feel. It would be very different.
Thank you. What are some foods or drinks? Yes.
I have several private questions that have been sent to me directly after this one. I'd like to ask as well.
Okay. All right. What are some foods or drinks that can help strengthen the immune system so we can avoid the virus?
So far, we're not aware of any. We're not aware of any sort of complementary things that can be done in terms of diet to help protect oneself from the infection. There just are no data yet. So I would do what you normally do to keep yourself healthy, keep yourself hydrated, get good sleep as much as possible, take your medications as prescribed, try to keep yourself warm. I would tell you here in Connecticut, it was spring just like it was everywhere else, a couple of days ago, but it snowed today. And I'm absolutely certain that my patients are hurting right now. So do what you can to stay healthy. But no, there's nothing that I'm aware of right now in terms of nutrition or anything that you can ingest that could help protect yourself.
Dr. Bailey, you wanted to ask a few questions?
I do. I have a few questions that have been sent to me directly. And Dr. Andemariam, thank you very much for continuing to answer our questions. I will let you know that there are over 80 people on this WebEx and over 60 people on the Facebook Live. And so we'll keep fielding the questions as long as you're willing to stay, but do let us know when you need to go.
Okay.
I have a question that from someone that sent it to me privately, that their son has just gotten over influenza and wants to know, are they more susceptible to COVID-19?
That's a really good question. I'm glad actually influenza came up because we are still in sort of the tail end of the influenza season right now. So there are plenty of people who are thinking that they have COVID-19 infection when they actually have the flu, which many of you know is treatable to some degree with pills. So, I'm not aware of anything, data tells us right now that if you've had the flu in the setting of this pandemic, that you're at any increased risk of COVID-19. One could hypothesize that having both at the same time could be worse. That's why it's really generally to make sure you get your shot so you can minimize the chances of getting the flu. But I'm not, just to answer the question more directly, I'm not aware of anything in the medical literature now that because you've had the flu, you're going to have a worse infection with COVID-19.
This next question is similar to that. Well, I suppose it's similar. If you've had COVID-19, if you have tested positive for COVID-19, are you less likely or more likely to, or can you get it again?
So I think that a lot of this is being worked out. Really great question. These are fantastic questions. For the typical virus, and of course, COVID-19, most of you call it coronavirus. It's a virus. So most viruses that exist, once you've been exposed to it, your body develops a really good response to it. What we call an immune response. Your immune system knows how to fight it so that the next time you encounter it, you can fight it quickly. And sometimes it's quick enough so that you just have mild symptoms. The best case is it's so fast that you never develop symptoms to begin with. I think we don't yet know about this particular virus. If it's like a typical virus where once you get, you're less likely to get it again. At least I hope. I think it's early days, and I think I know probably why this question has come. Have seen some reports, not anything robust, no robust data that people have some concerns that maybe this isn't something for which can have long-lasting immunity. But I think we just don't know yet. That's something that we're going to have to keep our eyes on closely to see if people actually do get reinfected.
Okay, thank you. Next question that I have privately is, actually this one wasn't private. You may have answered this, I'm not certain. This is there a greater risk for those with SS versus SC?
Is there, sorry?
A greater risk for those with SS versus SC?
Oh, not that I know of, but that's why I think something like this registry that I described is so important, so that we can share information from country to country amongst sickle cell specialists to see, if people with SC and SS are getting infected and having similar experiences with the disease as each other. I wouldn't want to send the message here, although I don't have data again, but I wouldn't want to send, let me say that in an affirmative way. At this point, all types of sickle cell disease are theoretically at the same risk of having a serious illness from COVID-19. So putting it a different way, if you
Dr. Andemariam, you muted.
there you go.
One moment, Dr.
There we go. So putting it a different way, if we at risk of having a serious illness from COVID-19. So putting it a different way. Are you guys there now?
Yes, we can hear you.
So if somebody tells you that, if you have SC disease, then you don't have anything to worry about, bottom line is that's not true. There's nothing that we know yet that tells us that SS versus SC versus S beta thalassemia is at any different risk from COVID-19 than anybody else.
Okay. I have another private question here. Before I ask it, everyone please mute your line. If you have just called in, please mute your tablet, smartphone. And Shalonda and Dominique, we need you to go through and mute everyone.
Is at any different risk.
I hear someone playing the Facebook Live feed, which is slightly delayed, and we can hear that delay. So if you could please mute yourself, that would help. Thank you. All right, next question that was sent to me privately. We're going to give it a second. Dominique, can you mute yourself for a second as well?
Yes.
All right, everyone, please mute to cut down on background noise. The next question I have here that was sent privately. Today, our state, Michigan, was issued the stay-at-home lockdown order by our governor. Several of our warriors are in a panic about whether or not to attend their doctor's appointments scheduled this week to get their prescriptions for pain meds. I've advised them to stay home as there are other options such as mail-in scripts, but they are insistent on going. I am afraid for them being exposed to patients who unknowingly have COVID-19. What should they do?
So if I hope that you guys will look at SCDAA Medical and Research Advisory Committee recommendations after call, because we address that. And again, every patient is different, every clinical situation is different. But if routine visits to the doctor's office for sickle cell disease, meaning not because you have a fever or not because you have signs of COVID-19, but just a routine visit, if that can be turned into a telephone visit or an electronic visit or telemedicine, all these different things that it's called, if that can be done, that's what we're recommending to providers, doctors, that they do. We're doing that in our own center. So we've barely had any of our patients come in the last week. We've been converting their scheduled visits to phone visits. So if you had an appointment with me at 10:30 last Tuesday, I called you instead of seeing you. And exactly what the person who asked the question said. It's to try to limit any potential risk of getting infected in the process of going from your home to the doctor's office. So if your medical team is willing to do that, I think it's reasonable to just ask them. Ask them if they're willing to call in medications for you, if they're willing to do your visit over the phone. There have been some changes to the way healthcare providers get reimbursed from insurance companies. Past insurance companies wouldn't pay the doctor's office that didn't occur in person, but that's changed in many instances in this pandemic. So some of those types of barriers that existed in the past don't always exist right now. So you may find that your providers of care are more willing, but again, it's by case basis. There are some patients that I have that I still want to see in person for various reasons. So it's a case by case basis. Call your provider and see what they think is right for you.
Okay, thank you. It looks like that individual sent that question to me once privately and then once to the public. I think that's it from the private questions right now. No, it's not. Yes, it is. That one was also repeated publicly. Okay. Also, just very quickly, Versetta, for that question, Versetta, CVS in many areas is now offering prescription delivery for free. So in the event that these patients can get their prescriptions called in, CVS is delivering them in many areas. So that's something worth looking into. And a number of private pharmacies are also offering free delivery right now. Mm-hmm. That's, Dominique, that's it for my private questions.
Okay, thank you. We would go back to, all right. Our next question is, is SCD considered special needs or clinical disability under normal circumstances and would entitle us to those arrangements for others?
So some individuals living with sickle cell disease do meet criteria for disability. That is true. Not everyone does, but some do. If the question, I guess if it's in the context of COVID-19, yeah, I think probably what I would suggest, because the devil is probably in the details here with this particular question, is that if your healthcare provider's office has a social worker, or if you can connect with one of your community-based organizations that focuses on sickle cell disease in your area, you may be able to get some help in answering that question in your particular circumstance. I think if the question is, does living in the pandemic with sickle cell disease and the need to socially isolate, sort of title somebody to disability benefits, I don't know, but it's a worthwhile question to ask. So I would encourage you to contact a social worker at your healthcare setting or contact one of your sickle cell community-based organizations for help.
Thank you. Is an X-ray helpful to see the virus in the chest or lung?
So so doctors do use X-rays, CAT scans to help them treat people with COVID-19. There are definitely changes that can be seen in the lungs, and they're pretty dramatic, which is probably why people start having respiratory symptoms like cough and then trouble breathing, because the lungs are really affected. So yes, those types of tests are used to evaluate people for COVID-19.
Okay. Here's a question. I have to go into an office daily. We are in cubicles. However, is there anything extra I need to do?
So yes, keeping your distance from people at least 6 feet. If you have common surfaces that you use, it's probably not a great idea. If you can have some sort of workspace separation, I don't know if you're at a computer or just a desk, but it would be better that if you had to share anything that you had to touch, that you wipe it down with something alcohol-based before touching it. That would be ideal. If you can ask to work from home, a lot of private sector companies, as well as government offices are instituting this and almost mandating it. So it's worthwhile to ask your direct report or manager. Sometimes your company's human resources department can also be a really good resource, as well as if you are in a union. It could be a good idea to contact your union rep to ask these types of questions, because you want to make your workplace environment as safe as possible.
Thank you. What part of the world has the highest percentage of sickle cell disease persons with COVID-19?
We don't exactly know yet. I am pretty much in daily communication with physicians Italy. In fact, one of my best friends is a pediatric hematologist in Italy, and there has not been much in the way of COVID-19 in the sickle cell patients, thankfully. I do know, and again, I don't know the global incidence, but I have a good sense of having my finger on the pulse and talking to different people. I'm not aware of a case in Lebanon. I'm in contact with doctors there regularly. I'm not aware of a case France, although it's possible. I do know that there were at least a couple in the United Kingdom, where London is. So there are small reports, but and I believe even this week in New York City, there have been a lot of there definitely have been individuals with sickle cell disease who've been hospitalized in the last few weeks, where COVID-19 was considered. But to my knowledge, and again, this is just anecdotal, to my knowledge, the majority of those are found to be negative for COVID-19. But this is exactly why that registry is going to be really important. But just to sort of, I guess it wouldn't be bad to give a little reassurance, although the message is still to stay home and socially distance yourself. But I'm not hearing about a lot of complications in our individuals with sickle cell disease. That doesn't mean that won't change, but I want you to know that we are monitoring that very, very carefully, and that's why we want these constant updates so that you guys are aware.
Thank you. What happens to our lungs post-COVID-19 recovery?
question. There's not a lot that we know. In reading the different reports, including from China, it does seem that a significant number of people do recover and recover well with normal lung function. I have read reports that lung function can be compromised or worsened, that is, but I think it's really all over the place. There are some people who are even who even have infection, but it's just so mild, not much in the way of symptoms. Those are usually younger and healthier people. So just like there's a lot of variability in sort of how we all, you know, have the common cold. Some of us get super sick. Some of us, it just, you know, it's more of an annoyance and we go along with our day as usual. That's what they're seeing across the globe with COVID-19. Some people, it hits them really hard and some it doesn't.
How would you treat a patient tested positive for COVID-19 with a history of acute chest syndrome episodes, stroke, and no spleen?
If they came in and had COVID-19 and they've had acute chest in the past?
Acute, yes, and a history of acute chest syndrome, strokes, and they no longer have a spleen.
So, okay, so I'll go backwards. So not having a spleen in anybody makes it harder to fight infection, because the spleen is such an important organ to fight infection. So I would worry about the infection being a bit worse. And in terms of if someone who'd had strokes, well, if that person was on regular transfusions, I would want to keep them on their regular transfusions to try to prevent another stroke. And if that person has had acute chest in the past, we know that anybody that's had acute chest once is more likely to have it again. And hopefully they're on some treatment for that to try to prevent it from happening again. But if they come in with COVID-19, at this point, I think most of us sickle cell experts would consider that person to be at higher risk for having acute chest syndrome during the COVID-19 infection. And so we've made recommendations to providers to be extra careful.
Dr. Andemariam, you're muted. I apologize.
I don't know how that happened. I'm not touching it.
No, I apologize.
I don't know what I said last. If somebody with sickle cell disease comes in and is diagnosed with COVID-19 and they've had an acute chest syndrome in the past, my feeling is that they would be monitored a bit more closely for acute chest syndrome, because what I'm trying to convey is that we have some concern that COVID-19 could make the development of acute chest syndrome more likely. And so if you superimpose that on somebody who's already had it in the past and is at risk for it again, then, we're advising all the doctors in that setting to be extra vigilant, extra careful to assess that patient for any signs of the development of acute chest.
Thank you. Another question. What are the risks to sickle cell disease patients if wrongly treated for COVID-19? Asking because when the swine flu outbreak happened, I was wrongly diagnosed and treated, and I almost died because of that.
Well, so right now we don't have treatments for COVID-19. So I guess the good thing is that the treatment of it, which would really just be supporting the patient through it, like giving them oxygen, and if their breathing got really bad, putting them on a ventilator temporarily, that none of those things are going to make somebody worse if they need it. It's not like there's a drug that's new that is very highly toxic to the body that treats coronavirus and somebody's going to unnecessarily get that. We're not there yet. So I would hope that people aren't, being found falsely positive. I haven't heard that there are a lot of false positives, meaning that somebody tests positive for COVID-19 but doesn't really have it. I'm not hearing that about these tests. That's my answer to that question.
Okay, thank you. We have a question. How do you know if you are asymptomatic with COVID-19?
You won't really know. Probably the only reason you would even be thinking about it if you didn't have symptoms is if you found out that you were exposed to somebody who got diagnosed. And this is happening all the time. You know, you probably see it in the papers, in your own communities, maybe in your own families, where somebody at your church last Sunday, yesterday, you know, came down. I'm like,
Yeah.
track of my days. But you know, if you found out, oh, someone at church, you know, yesterday came down with it, oh my gosh, I was, you know, I was hugging him, I was whatever, you know, then you might start to be concerned about having coronavirus. And that's another reason to call your healthcare provider and see if you should be tested. But if you don't have symptoms, you won't know. That's the truth of the matter unless you get tested. And where we are in this country with having such a limitation on tests, people probably won't get tested in that kind of situation without symptoms. That's my best guess for what's happening across the country.
Next question is, what is the average age of the SCD patients that have tested positive for COVID-19?
There have been so few that I know of. So I don't recall them being very young. But it's been there's so few I couldn't tell you. I personally have not heard of a child with sickle cell disease having COVID-19. That doesn't mean that it hasn't happened. I just personally don't have knowledge of it. But the people that I do know of have been a bit older, 40s and 50s.
Thank you. We have another question. How do you treat restrictive lung disease? Lungs are smaller with scar tissue alongside COVID-19.
That's a really tricky question. Is that from a doctor?
No, no, it's from a patient.
Okay. Well, that can get challenging. There's no doubt about it. I'm not a lung specialist per se, but I think that if somebody has restrictive lung disease, meaning that their lungs are just a little bit tight, harder to, that if you had a really bad infection with COVID-19 where it was hard to breathe, that it might make it worse. But I honestly don't know for sure. That's why, again, the number one message is try not to get it in the first place. It looks like those of you in your beautiful faces I can see are home. Stay there. If you can. But it's a good question. What I want to tell people though is I'm guilty of that myself, thinking about worst case scenarios and oh my gosh, how does this particular crisis in front of me, affect me? How does it affect my family? What I will say is try your best not to get worried and to panic. It's easier said than done because we're kind of everything that you're being told is in the news, and a lot of what I'm telling you today is about how to prepare yourself for the worst, and that's almost sort of the definition of being in a panic mode. So
Yeah.
I feel like such a hypocrite in saying that, but it's so important to try to maintain some degree of normalcy right now, whatever that is. And I know none of us are living in a normal way, especially if we're talking about isolating, working from home, not going to the doctor for your prescriptions and your routine follow-up, not necessarily going to the emergency department, even though you're in pain, trying to manage at home more and more and more. Like those aren't typical normal things. But if there are ways in your lives to take a challenging moment like what we're all living in right now and create something new, like I'm showing my age right now, but I know a lot of people were on the D-Nights Instagram party Saturday night. Apparently, I didn't get the memo until Sunday morning, so I totally missed it. You don't know anything what I'm talking about. What?
No.
There are ways to create physical distancing without emotional distancing. And I almost wish that this term of social distancing had not been created, because I think That's not really what we're trying to say. We're trying to say keep your physical distance a reasonable amount from one another, but we all, particularly in a period of crisis like this, need more emotional connection, more support. So we're not thinking and overthinking. And I tell you, I'm one of those people that does that. So if it's not D-Nice, if it's some other, DJ that's closer to your age group that you want to see if they have an Instagram party next Saturday night, go for it, because these things are really keeping people uniquely content and calm in a period of time in which there is absolutely nothing calm about living in it. So I urge you all to find ways to do that.
That's good, yeah, because so we need to start thinking of it more as physical distancing instead of social distancing. So we don't, I guess, go crazy with anxiety.
Yeah, because anxieties will, anxiety, depression, feelings of isolation will only get worse, for those who are already predisposed or those who may be feeling it for the first time. And we know that there's a connection between mental health and physical health. We can't always connect the dots directly, but there's a connection. And, I've been, taking care of individuals living with sickle cell disease long enough to know that just having sickle cell disease can be isolating in and of itself. And so if you're going to superimpose a worldwide pandemic in which the treatment of choice is to isolate yourself so you don't get it, you are creating a recipe for disaster in terms of the emotional well-being of individuals living with sickle cell disease. And I think we need to address that, and whether there needs to be, maybe through the consortium, an opportunity for a party, or doing something like this where you can see everybody, but not just an education, but like an actual dance party. I was I'm not endorsing anything, but something came across my email where Netflix is allowing you to download something that allows you to watch something at the same time as somebody else who lives in a different home. Forget what, but that's an opportunity to almost pretend like you're at the movies together, right? As opposed to having a isolated, streaming night. So what you as warriors and folks in the consortium can think about is ways to help each other, whether within the sickle cell community or in your individual private relationships that have nothing to do with sickle cell disease. Now is the time more than ever to do it.
Well, you actually answered my next question. Someone had asked, how should I deal with anxiety dealing with the COVID-19 pandemic, given that people with sickle cell already have a slew of health problems? So the suggestions that you gave were amazing suggestions already to dealing with anxiety, and just knowing just because you're isolated doesn't mean you have to be emotionally and socially isolated. We have video chat. There's different games and different ways to still interact with people, but not being physically close to them. Exactly. So to think of it as a physical distancing and not social distancing. Mm-hmm. That's a great one. Another question I'm sorry, Dr. Bailey?
I was just going to point out that we actually have quite a few things that are scheduled and coming up. Warrior Games, and we'll be announcing a series of different Warrior Games and teams coming together to solve a mystery, an online escape room, an online scavenger hunt, a book readathon. There's a lot of cool stuff that the team has planned that I think are going to help with the sort of interaction and engagement that our community is missing. Not just being able to leave, but a lot of our meetings have been canceled. The Leadership Summit has been postponed. A lot of the things that we would normally get together for and see each other as sickle cell warriors aren't happening right now. And so we're working on ways to sort of replace that.
Yeah.
Just a few more questions. I have clients with sickle cell disease who are just getting over pneumonia, which also has similar symptoms to COVID-19. If a client has similar symptoms to pneumonia, will they still be tested for COVID-19? And if so, is there a fee to get tested for COVID-19?
We are advocating the medical and reproductive from SCDAA, we call it MARAC. We are advising that anybody with sickle cell disease with pneumonia or symptoms of pneumonia get tested for COVID-19. We're advocating. I can't tell you what the practices are at your various healthcare settings, but one of the key signs of COVID-19 is a lung infection. So I'd be very surprised if somebody had pneumonia in this day and age and wasn't tested for COVID-19. I'd be really surprised. In terms of cost, if you have insurance, as far as I know, insurances are covering it. I also I'm trying to keep up with all of the news from our government. I thought I had read that testing was going to be covered. Even in the circumstances of people who don't have health insurance currently. I mean, don't quote me on that, but I did read that this past weekend or maybe just before. If I wouldn't want, I'm really passionate about this. We are living in a time where everything is about our health. And if there is somebody with sickle cell disease that's out there asking this question who does not have health insurance, is concerned about not being able to be tested if they have symptoms, I would really urge you to call your local sickle cell community-based organization. You can go to sicklecelldisease.org and find the one closest to you, or call the national office. Because I bet that resources can be identified in your community to help you get tested and not make cost a barrier. In fact, if somebody is finding that barrier to being tested, we want to know at the SCDAA. So please do contact our office, because we want to make sure that that's not an impediment to care.
Thank you. Another question is, while main concern is respiratory and lack of oxygen can affect brains, plus those of who had meningitis have had latent effects, how may COVID-19 further affect the brain?
I'm not aware of effects on the brain. You can imagine, though, if it's not enough oxygen, that they might not get enough oxygen to the brain. So I can imagine that if somebody has really bad COVID-19 infection to the point where they're not oxygenated, they're not getting enough oxygen to their body, that the brain could suffer. But I'm not aware, again, this is early days and we're all learning things, but I'm not aware that people who have recovered have had any brain problems, whether that be stroke or difficulty with memory. But again, these are early days and we're still learning a lot. I'm not aware that there have been long-lasting brain side effects from having COVID-19 if you recover.
Okay, another question, and I know I've been doing this since we've been on the video. I'm working on it as well. If you're at home mostly, should you still be wary about touching your face, your nose, etc.?
I have that problem too.
I have that problem too. I'm working on it. It's a hard habit to break.
So I think it is hard, and having your face on video, you can actually see what you do. I've noticed that I've been doing that. So if you're home, presumably you're listening to what and other people have been saying, and trying to make your home a really sort of protected environment. You're cleaning surfaces. You're making sure everybody that walks in your house washes their hands before they do anything else. So in your home, if you're cleaning things the way that you should, then touching your face is probably not a big deal. I wish that you wouldn't, but probably less of a problem in your own home, and everybody's self-isolating. risk is there. Probably the bigger problem in your own home, you have that habit outside the home and you don't even know it. So I think a lot of us have to take that habit. I don't have a suggestion, but if you, that would be really good. Just putting your phone on speaker if you're not holding your phone right to your head. Those are we come communicate with our face all the time.
Another question someone asked, for a lot of sickle cell patients who are past the transition age between the middle of 18 to 25, maybe a little older, for those who do not have hematologists and those who do not have primary physicians, and those who seek treatment for their sickle cell through the ER, they're being told not to go to the ER really, to contact their physician if they're having a crisis attack and see how it goes from there. What advice can you give to patients who don't have a primary healthcare provider or a hematologist? What should they go about if they are having a crisis attack?
Yeah, so there are options, and of course, the emergency department is always going to be an option. If there's no, but let's try to think through that. So there are community health centers across our country whose charge is to take care of patients in the community, and so community health centers are places that you can go. You can call your local community-based organization to see what other resources there might be. There may be hematologists and primary care physicians in your region that have good experience taking care of young adults with sickle cell disease. You might just not know that they exist, and they may be willing to see you. I'll tell you, if anybody's in the Connecticut area and you don't have a regular provider, we'll be happy to see you. So I think that calling your community health center, calling your local community-based organization, even calling the national office to see which of the providers that we know about across the country are closest to you that you may be able to connect with. Those are the different resources that you can try. Oftentimes, your payer, like your insurance, if you have insurance, you can call your insurance and ask them for preferred providers as well. That includes state Medicaid. State Medicaid has lists of providers, and in fact, you probably, if you have state Medicaid, you very likely have a provider that you've been designated to. Those are the different resources I can think of.
Okay. We're going to take 2 more questions. This has been amazing, but we're going to take 2 more questions. Any advice on how to completely isolate myself from my family? I'm afraid someone will bring home the virus and infect more people, but we share the same pot, plates, bathroom, etc. Any advice?
That's a tough one. It's hard to
completely isolate myself from my family. I'm afraid someone will bring home the virus. Sorry, can everyone please self-mute? We're getting the feedback from Facebook.
Okay, thanks. So that's a really hard one, because I think you can do a much better job yourself and changing your own practices than it is to change the practices of people that you love most who love you. Sometimes that could be the hardest. So this might be an opportunity for
Everyone please self-mute.
okay? Yeah, can you hear me?
Yes, we can hear you.
I'm going to say
this might be a good opportunity for that good old-fashioned family meeting, where you get everybody into the kitchen and you teach them what you learned today. This is recorded, so you can give them the beginning of this recording, and you can tell them how vulnerable you are as a person living with sickle cell disease. Presumably, the people in your house know you have sickle cell disease. If they don't, maybe now's a good time to tell them, so they can appreciate why they themselves have to change practices. Now, if you're saying that, it's not so much that you're concerned about the surfaces being not being cleaned or people not washing their hands, but it's just a matter of using common spaces, you know, that's different. You may just have to take turns in the bathroom. You might have to ask the last person that used the bathroom before you to wipe things down before you go in and take your shower or brush your teeth. You know, you might just have to say, look, that might be somebody, maybe there's a little person in the house and it's their job every hour to go around spraying everything. You know, that might be a little bit excessive, but if there's a separate place to sleep, or if you can move beds around, if you share a room and you can move beds around to be at least 6 feet apart from one another when you're sleeping. You know, if it were warmer, and maybe it is where you guys are, opening windows couldn't hurt to try to get some fresh air. I know that can be tough because you don't want to get cold, but if there are ways to try to keep away from one another, again, not everybody can have their own bedroom, but if you can, that would be great. In terms of pots and pans, you know, you should be able to use pots and pans. Just wash your hands before you pick up anything and put it in your mouth. Like, you know, cook dinner, cook whatever, and then before you actually eat the food, give your hands another good scrubbing. You're going to have to be able to live in the environment, in your home environment, but just wash your hands frequently and try to have people, you know, keep at least 6 feet away from one another.
Okay, thank you. And the last question is, I have appointments twice a week for iron overload infusions. Should I try and see if I can cut down on how many times I have to go in for that?
Well, that's a good question. You know, and everybody's situation is different. But, you know, it could be iron infusions, it could be medication, it could be transfusions, or a lot of things that might have people go port flushes, apheresis. There are a lot of things that are routine care that might have individuals with sickle cell disease going in on a regular basis, even as much as twice a week. So I would call your healthcare provider and see if they think that if they think there's any risk to missing one of those infusions, or is there an alternative to treat your iron overload that doesn't require you to get an infusion. I think that, you know, get their opinion, because everything here is about risks and balancing risks. So is your iron overload so bad and you're at such high risk for a complication from that, that it's worth the risk of getting COVID-19 as you come in? I can't answer that question, but that's kind of how you have to think about it. Where is the greater risk to me as an individual with my particular situation? Again, port flushes, going in for prescriptions, going in for, some people are on crizanlizumab, that new drug, that's an infusion. Some people are on transfusions regularly. You got to have that discussion about balancing the risks with your provider, and do it over the phone. Call them first. You may save yourself a trip in.
Dr. Andemariam, we actually have quite a few questions on here that are left, as well as a few that are not directly COVID-19 related. I think we can go through and answer the majority of them. I know I can go through and answer several of these as well. If we have any that are specific, that would you mind if we email this to you or send you a couple of these questions that we could then give to the people that are asking?
Sure, yeah, absolutely. I'd be happy to do that.
Okay. I think we'll do that then, because we don't want to hold you indefinitely, but the questions are still pouring in on Facebook, and I'm actually getting message them directly on Facebook as well.
Oh, wow, okay.
So they're still coming in. There's quite a few people. We've lost a lot of participants on the WebEx, but we seem to still be gaining some on the Facebook Live. So thank you very, very, very much. I think I'm going to go through and try to answer as many of these as I can, but if there's any additional, we'll send them over to you.
Sounds good.
multiple questions, though, that do seem to all be related to how are we defining fever, and so if we could wrap up with this last one, the questions that have come in online, on Facebook, and in my message are all related to, I've heard that some people have fevers with COVID-19, others do not. How are we defining low-grade fever? What does it mean to have a fever? And if we do have a fever, should we just assume that even if we have symptoms of the flu, should we assume that it is the flu and just self-isolate until we know better? It's all related to those collection of symptoms.
Do you want me to answer that, or you want me to hold on that?
Yeah, if you would, if you could just touch that last one, if we chop the head
So
out.
101 degrees Fahrenheit or higher is a true fever. But if you're continuously taking your temperature and you're rising higher and higher, if you started at 97, you went to 98, 99, 100, you're not feeling well, call. Don't wait 101, okay? If you think you might have the flu, I think that's what I heard, should you just ride it out at home? Never. If you have sickle cell disease, you are at high risk for a bad and a worse infection than the average person without sickle cell disease. So even something that's the flu, for which the average person would just deal with at home, you always want to get checked out for that. It might be something else. It might be the real infection. It might actually be the beginnings of the acute chest syndrome. So I wouldn't stay at home with the flu. So I would definitely get that checked. Can you guys still hear me? I don't know if there was a.
Yes.
Okay. What was the other part of the question?
That was it. If the flu,
Okay.
should we wait it out at home, and what is a true fever?
Right. Yep. So definitely make sure you have a thermometer. That's really important, right? Oh, I think the other question was, can you have COVID-19 but not have a fever? I think that was part of the question. Yes. The answer is yes. So again, the three most common symptoms are fever, cough, and shortness of breath. Excuse me, fever, cough, or shortness of breath. So you don't have to have all of them. You can just have one of those, and you would be right to be concerned that you might have signs of COVID-19. So if you have any of those symptoms, you should call your medical provider, even if you don't have a fever.
Thank you.
You're welcome.
Thank you so very, very much. I just have a couple last closing remarks, and then we'll hand it back over to Dominique. I know everyone's muted, but psychically, let's give her a huge round of applause. And thank you so much for joining us. Thank you for spending all of this time answering these questions. We're very, very grateful. Everyone, this was recorded, and we are going to make it available. If you want to go back and take a listen, see the presentation, it will be available at www.sicklecellconsortium.org, as well as Dr. Andemariam is doing this again. Dr. Andemariam, when is that? When are you all scheduled to do this, another presentation?
I don't think I have a date and time yet, but we'll get it to you. This is with the SCDAA, right? With the,
yes.
Yep. I'll get that information to you. By then, I'll probably have some updates.
Okay, thank you. And so SCDAA will also be bringing Dr. Andemariam, and there'll be another presentation with a Q&A session, and we'll make sure you all find out when that is so that you can join that as well. If you had a question that was not answered here, please email it to Dominique Goodson at dgoodson@sicklecellconsortium.org. Include your question, name, and email, and we will work to get them answered and sent back to you. And also remember SCDAA session. I believe there'll be a Q&A section as part of that as well. Dr. Andemariam, there was a question that I'm going to go on and ask you, and it was, they said, as we wrap up, to please ask you, to your knowledge, will the SCDAA convention still be going on in October?
As far as we know, we have not,
Okay.
we've not postponed or canceled it, but we're being respectful of the fact that everybody else is focused on the pandemic and getting getting themselves prepared. So we haven't been bombarding people with announcements for registration. We're holding on registration right now. But yes, our plan, God willing, is to be able to still be in Orlando in October for the SCDAA convention. I hope to see you all there. I hope we're all past this by then.
Absolutely. The individual asked, would you please give the date? Do you know those dates?
Yes. October. I believe it's October. I think it's the 13th to the 17th, but it is on the website, sicklecelldisease.org.
Thank you.
I have the dates wrong, so double check.
Okay. Someone asked about the Leadership Summit. The Leadership Summit was canceled. That actually would have been this past week. And we are hosting a digital summit. So you will all be invited. We're working with the technology, figuring out some pretty cool ways in which to still do the breakouts and do this entire thing digitally. The other question, or now the other comment is, there are other meetings tomorrow. As we wrap up, we are working to make sure that we get an opportunity to address the needs of the patient and caregiver community. Tomorrow at 7 p.m., if you are a parent living with sickle cell or raising children with sickle cell, we invite you to come and join us on a call so that we can identify and begin addressing needs of the parent-to-parent network of Sickle Cell Consortium. Invite you on a call so that we can identify what parents need and how we can help assist you get through this time. I know that as it progresses, we're seeing more and more people that will need direct social services. And so if you are partnered with the consortium, there are 42 CBO partners. We're asking that you all meet us on Wednesday at 7 p.m. Eastern so that we can define how we're going to begin working on social services and educators. We're working on putting together a platform because it does not look like school will be starting back at all this semester. And so educators, if you are an educator in this community or and are willing to help us, we're working together now to put together a platform to provide support, educational support, to help get your children through the last of the semester. I've had lots and lots of phone calls from overwhelmed parents, and so we do hear you. We know this is really, really tough to suddenly have children at home, and we're working on resources, identifying ways in which we can help. And that meeting, if you are an educator, if you are a parent, please join us tomorrow or would like to help with that, tomorrow at 7. If you are an educator, Friday at 7. And all of that will be available on the consortium's Facebook page, the login information. There is also some work being done now because of the anxiety. We are going to be doing some pretty fun events. Those will be announced soon. Just engaging ways to have fun, have competitions and things of that nature. Please, please remember to check out SCDAA's website, sicklecelldisease.org. The living document that you all were emailed, it is constantly evolving. Everything that Dr. Andemariam talked about today, as they meet weekly, it'll be evolving with new information, and it's going to be very important that we keep an eye on that website the way you're watching the news. This is the news that is specifically pertinent to us. Check it weekly, keep it updated, send it to your family and friends, and make sure you are staying on top of things. SCDAA has taken fantastic leadership, and they are keeping us apprised for the research and the medicine. And we're very, very excited for that and grateful. We're working now to put together resources. We've decided instead of continuing to ship out pallets of water, we are going to be sending out water filters that you put on your sink for families. As we get all of that put in place, keep an eye on the website and on our Facebook page for announcements on how to take advantage of the social services that will be offered to you. Thank you again, Dr. Andemariam. This was absolutely wonderful. Thank you for answering our questions. And if there's some more questions, we'll shoot them over to you. I think some of these questions are a bit redundant, so we should be able to just take the answers you've already given and go on and share them with those that are asking. Now I'm getting a number of questions that aren't COVID related. I think we're just really excited to have such a fantastic doctor online that everybody wants to just grab you and get all their questions answered.
Okay.
We might actually send you a couple of those as well if you are okay with answering them. I've got questions about lupus medication and red blood cells. I've got questions about, I've got a lot of questions that aren't necessarily COVID-19 related. We'll send those over to you as well.
Okay. Sounds good to me.
Thank you
for
so
inviting me.
much.
Thank you.
Absolutely. Handing it back over to Dominique. Is Dominique gone? You're muted, Dominique.
Yes, Dominique was booted off of the call, so she is off right now, Dr. Bailey. So if you can just say your last words, and then we can go ahead and end the call.
Oh, wonderful. Thank you, Sharonda. Then that is it. Just a reminder of the statement that was read at the beginning, that this is for educational, informational purposes only. The advice given here is not meant to replace your individual doctor. Just remember the person that has your charts. Dr. Andemariam gave us some wonderful information, but you do need to seek your own individual physician, and remember that advice is not meant to replace your physician. Thank you again, everyone, for joining us. I'm super excited. At our height, we had over 80 people here and over 60 people online. Feel free to share the video on the Facebook Live. We'll leave it up. Share it as many times as you want. Thank you again, Dr. Andemariam. You have a wonderful night.
You too, everybody. Good night. Stay safe.